Very good afternoon to you. My name is Mark Drax, and I'm speaking on behalf of SASH. And this afternoon, I have the great pleasure of talking to Michael Crocker, who's going to be talking at our upcoming SASH online conference, our first online conference, like many these days. Michael, a warm welcome to you.
Thank you. I'm happy to be here.
And you're tucked up safe in New York, I believe.
Yep, I'm in my office.
Fantastic. Well, I'm
how
glad
how safe I feel, I'm not sure, but I am in my office, and I'm as safe as I can be. So that's good.
Good. Well, it is lovely to be with you this afternoon, Michael. Thank you for agreeing to talk to us. It's wonderful. And thank you for agreeing to present at our upcoming conference. We're very excited about that.
Yeah, you're very welcome. I'm excited too.
Michael, I've got two screens in front of me. On my left screen are the questions, and I've also got the title of your talk. And I'm going to spell this out for people that might be interested to watch this video, because I think personally it's one of the most fascinating topics that is being presented this year. The full title is Gender Development and Superego Pathology as it relates to obsessive compulsive sexual behavior, from victimhood to emotional literacy and agency. Michael, why don't you, first of all, I'd love you to tell our audience what that is all about.
Okay. Well, I mean, it's such a relevant topic right now, and it's really, I'm really excited to be able to present about it, because I feel like this is the work that our men and that I have to do, and that we as a society have to do, is how do we help men to be more vulnerable and to have emotional literacy, to actually know what they're feeling. And so in my work, and I've been doing this now for 25 years, which is mind-boggling to me, but I have found that men, and this is backed up with research, is that men are socialized out of their emotions. And that I think it was the book Real Boys by an author, Pleck, I forget his first name, and also another researcher, Pollock, where they actually did videos of watching how parents would deal with their little boys versus how parents dealt with their little girls. This is really fascinating to me. So with their little girls, they had a tendency to do more mirroring. To if the little girl was having a feeling of sadness, they would be like, "Oh, tell us why you're sad," and there'd be much more of a dialogue about the emotionality that the child was experiencing. With little boys, what they did was most often they tended to distract the boy from his feelings, give him a toy, tell him to watch TV, somehow get him away from his feeling states. That to me was fascinating when I was reading about this and trying to study this and understand this in my studies. I was like, this is what we're dealing with the men that come to find recovery and to be in psychotherapy, to try and understand who they are and why they've made the choices that they've made, which didn't feel volitional to them. Is I've explained that because of the way that men are socialized, if you go back to the original definition of acting out, which we hear that term all the time, is that, Freud said acting out was jumping over the emotional awareness. There's no conscious, in a sense, you're not consciously formulating what you're feeling. You jump over it, and then next thing you know, you're in an action. Mm-hmm. And that is what the men that I have worked with have, what I call a manic defense, where they'll have a feeling state. It will exist in their body. As we know, affects and feelings are in our body. That's why we sometimes feel it in our chest or back or gastrointestinally. We experience it in our body, but because men have not been socialized and trained as well to be able to formulate what that feeling is and then use it relationally, they instead jump to action, and before you know it, there's some sort of acting out, which can be sexual, it could be substance related, it could even be just workaholism. It's like, I'm going to jump to a distraction and I'm going to jump to an action and I'm not going to really know what I'm feeling. And so it became a real crusade for me in many ways of saying, I want to help men know what they're feeling. And I want to help men get in touch with their vulnerability and find ways to talk about that. And that's really been my work for 25 years now. So it's really exciting. And the superego pathology part is much more about the fact that men are, in many ways, unfortunately, this is all, again, very much a social construction, but men experience something that they call the gender role strain, which Pleck came up with. And basically what that means is that the young boy, who then ends up being like a preteen boy, is emphatically separated from the parental nourishment that they were experiencing, because now they've got to be tough, and they've got to be self-sufficient, and they've got to figure things out on their own. And that's a shame. That's a real shame that we as therapists end up having to try and find some sort of direction for them to go in where they can somehow repair that. It's really about reparation. And but one of the things that happens is, because there's this emphatic separation from parental nourishment, because somehow the boys feel like they have to figure it out on their own, there's also a lot of intense affects related to that. There's anger, and there's fear, and there could be sadness and grief, but they're not, because boys are socialized this way, they're not experienced consciously in so many cases. And then the next thing you know, they have a harsh superego, which basically means that they're shame prone. There's a perfectionism about how they want to exist in the world, rather than being able to recognize that sometimes we hurt, sometimes we don't know, sometimes we really need to reach out and get help. One of the ways I talk about it with my guys is, I don't call it self-sufficiency, I call it toxic self-sufficiency. Because I want my clients to understand that this is actually not good for you. It may feel resilient, and you may feel empowered in the moment, but all of these feeling states that are underneath are not being dealt with. And so I call it toxic self-sufficiency, which really kind of fits in with what we've been hearing so much in our society these days, is about toxic masculinity. You know, and what does that mean? And so much of that is about a real struggle with being vulnerable and helping the person to move away from shame, which is really a spiraling down, and it's not a connected way of being in with the rest of your emotions. I call shame the wet blanket that goes over all the other emotions that get muted. Then there's the risk of self-attack. There's a risk of doing things that you would not approve of, about doing things that are against your real moral compass, but you don't even have a clear sense of it, because you're jumping to action. So that's really where this talk came from, because I really wanted to start to formulate what I was seeing in front of me with these men that would come in. And you know, I often say that the men that come in to see me, back in the day when we were doing sessions in person, none of my male patients ever came early to sit in the waiting room and actually reflect on what they were feeling. They either came right on time or they were late. And when they were late, they came in and it was just another appointment. They were so busy and so harried, and I got to get back to the office. All ways to not know what you feel. And so that had to be addressed very directly with the folks that I worked with, of noticing kind of what I talk about in some of the papers I've written, the insecure avoidance style that has all this fear underneath that's being defended against. And so that's why this talk is particularly exciting for me.
Michael, I just want to say, I'm sitting here feeling as though I'm attending the best lecture at in a university hall I've attended in years, because I'm relating so strongly to everything you've said from my own journey. Yeah. So I bless you for tackling this subject, because it is so important right now.
Thank you. Yeah. Yeah, I'm really excited.
Michael, finally off, the next question we've already covered, because it says, why is this topic important? You've already covered it. I mean, the world is at a turning point because of toxic masculinity, how men abuse themselves and by default women. And so we've kind of covered that. I would love to ask you, what would you like participants to take away from your presentation? Maybe a few bullet points. What would you like to take away?
Yes. I got a few bullet points. Is that one is I want participants to understand the social construction of gender, how both women and men pay a price for that social construction, and that price has to be understood. So I'll speak about the men that come in to see me, and this is what I'm hoping that people will take away from the presentation, is that I immediately have to assess where they are in terms of their emotional literacy. And I immediately need to assess how severe their superego is, and said another way is, what degree of shame are they suffering with? And then what I would like for the participants to be able to take away from my talk is their ability to recognize that in a more effective and efficient way. Like to be able to recognize that when someone is incapable of telling you what they're feeling, then it's our job as clinicians to figure out how we can find the feeling. And so that has a lot to do with being able to be attuned to one's body, and to ask our particularly our male patients, if they don't know what they're feeling, can they talk about it from their body? Is there a tightness in their chest? Do they notice that their shoulder? One of the things I always notice about myself, which since I've been doing this work so much, is that I have a tendency to pull my shoulders up. And there's something about that indicates to me that I'm having some sort of anxiety. I'm surprised my shoulders aren't all the way up here right now as I speak and get recorded. But that's interesting, right? Is like, for we as clinicians, if I can help clinicians to help their patients and their clients to identify where that feeling state is in their body, then they can get to the point of actually naming the feeling. I have this great feeling chart that I used over here that's in the other part of my office. And so in doing that, you're actually helping the client to, first of all, not be covered by this wet blanket of shame. And second of all, start to develop the emotional literacy, which then the goal is, and this is the goal for the clinicians, is to help them use the feeling state relationally. Men have a tendency to not use their feeling states relationally because they have not been trained to do so. And that we as therapists need to be the ones that are going to train them to do so. And that they will be, if you don't feel one type of feeling state, then you're going to block all the others. You're actually inviting people to become more enlivened in their lives, to have more positive affect in their lives as well, not just recognizing distress and fear and sadness and anger, but joy, excitement, interest. Those are all considered affects, and we have to help people to experience them all. So that's part of what I'm also hoping that people are going to take away some ideas about the underlying issues of sexual addiction and out of control sexual behavior that are related to affect management and affect regulation, and that our job is to help our clients to become better regulated.
Brilliant.
So
I again, relating very strongly here, for years, if I got into a state of anxiety, my diaphragm would start to spasm.
Exactly.
And for years, I completely ignored it. And of course, guess what? I acted out to avoid it. I didn't want to feel it. I knew it was a horrible feeling, but I just didn't want to go there.
Right.
Well, today, when that feeling comes on, I immediately, I know, right, I've got to stop and ask myself, what's going on for me?
That's wonderful.
The somatic awareness piece.
Yeah, there you go. And also that in your own recovery process, you've obviously found your way into emotional literacy, which is such a gift.
It's been a huge gift, and some very, very amazing people have helped me along the way to get in touch with that side of my life. And today, God, I cry watching Americans Got Talent, let alone when I deal with a difficult situation.
Right. I cry at commercials. So there you go.
You're a good man to admit that with me.
Oh yeah. Yeah, no, I can be quite tearful when it hits me. So
Michael, what excites you about this year's conference in particular? Anything that jumps at you about this year's theme?
Well, I'm gonna, actually expand that and say that it's what excites me about SASH.
Thank you.
Is that the reason that I've stayed associated to SASH, and I've presented at the SASH conferences 1, 2, 3, 4, maybe 5 times, is that what I so appreciate in the SASH mission and statement is the idea of sexual health. So there's a sex positive view that I believe SASH brings with them in their conferences, in the work that they do, and I've wanted to be associated to that. Because I'm not, sexual anorexia is not the answer to sexual addiction, right? So much of it is that how to help men find that. For me, it's mostly men that I'm working with, and I work with couples and I do men's groups, but helping them to find what is sexually healthy for them and their relationship. And SASH represents that. I feel like I've always admired the change in their name from when they went from the National National Committee on Sexual Addiction and Compulsivity to now becoming the Society for the Advancement of Sexual Health. That excites me. So that's what's exciting about this particular conference, and pretty much everyone prior to it that I've attended or presented at. I like the message.
Michael, bless you. And I echo everything you say. I mean, and definitely, whereas with drugs and alcohol, yes, abstinence is a pretty good idea.
Right.
With all the behavioral addictions, possibly with the exception of gambling, you need to eat, you need to exercise, you need to work, you need to have sex to have a healthy life. You can't stop these things. So learning how to do them healthily is actually the biggest challenge. And I think that separates them from the chemical addictions where Nancy Reagan, bless her, her famous slogan, just say no. Well, we all know you can't just say no, but you definitely have to stop.
Right.
Michael, COVID and going online clearly has been a huge part of the last 6 months of all of our lives. And some of us see this as a negative, some of it see it as a positive. I'm going to ask you for a positive spin, if I may. How can you see, how have you discovered that actually having been forced to embrace Zoom and whatever other technology you might use, how has it helped you? I mean, okay, certainly it's not as nice. I know it's not. I love to meet my clients and give them a hug and walk and talk in my garden. But I mean, there are positives to come out of this last 6 months. How's it helped you?
Well, yeah, that has been an interesting journey for me. Because there was such a learning curve in terms of doing all this online stuff, which I was not really used to. I pretty much saw everyone in person. I had a few phone sessions here and there, but all of a sudden we're thrown into this. One of the funny things that I think has been a silver lining to this is that no one's ever late. No one's ever late. People show up all the time. No one has the excuse of I'm stuck at the office. And that's been just kind of, it's been an interesting, like for my group, when I run my groups, there's always people trailing in, trying to, take the last sip of their Starbucks coffee or whatever it is. But that doesn't happen anymore. They're all there. And so that's been just like interesting to have the consistency of treatment. And the other thing is that I've experienced in these COVID days is the level of support. Because I do a lot of group work, I'm watching how group members are working together, and it feels like a huge shift of concern and care for one another that easily they were easily distracted by when in pre-COVID days. Mm-hmm. Pre-COVID days created the mania of the office, the the mania of our lives. And now with COVID, everyone's, the challenge is they always have to find a private room, right? So I've had a few people that are in like a bathroom, and I'm like seeing their toiletries, and that's always weird. But but I do find a level of consistency and connection. I feel like I will tell you that there's a few clients that are actually more back to the idea of vulnerability and tuning into oneself. They are more vulnerable on Zoom. There's something more open about what they're experiencing with me at that moment or with other group members. And that's been interesting to see.
That is very interesting. Maybe because they feel safe in their own surrounding.
I wonder about that, because I have seen, I can tell you a good percentage of people that are expressing more now that we're doing these virtual sessions, and there's something to that. I don't completely know what it is yet, but it will be interesting to like learn more as we go along with this and see what we discover, because I did do a lot of writing about the negative effect of the pandemic, but I like your question, is that there are things for us to look at that are interesting and helpful and actually really productive about doing the virtual sessions.
Do you know what, Michael? Just hearing you say that clients are on time makes me think that maybe this will be the first SASH conference where delegates are on time. Because right? I'm one of the presenters, you're one of the presenters. We're going to start on time. And if someone wants to catch our talk, got to log on at 10 o'clock or whatever it is. I actually can tell you are actually presenting between 8 a.m. and 10 a.m. on Thursday, on Thursday the 15th.
Correct.
So in fact, you're one of the very first presenters.
Yeah.
Michael, it's been an unbelievable pleasure talking to you. I so love your topic. Yes, I have a huge personal bias because I'm in recovery. I've been studying myself and recovery for 16 years since I was 35. I'm 53 today. So it's been, listening to you has been an education for me. I hope it will be for everyone that tunes in on the 15th of October. But Michael, any closing words?
Closing words is that, I guess one thing I'll say, and it relates to the whole COVID thing and my professional life, is that I do think that this is an opportunity for us to reinvent and reorganize ourselves. Like, you're back to your question about what are the positive impacts. We've got to keep moving on. Like, there's too many people that are suffering. And right now there's a lot of suffering because of the pandemic and the fires and just the anxieties about government and politics. We really need to stay in it. And one last thing I'll say is, one way to stay in it is to make sure, using the Al-Anon slogan of putting the oxygen mask on first in order to help others. Like, we've got to make sure our self-care is in place. 100%. And that's what I learned that in the beginning of the pandemic, because I was like, I have to find space for exercise, time for myself, ways of connecting with others personally. It's essential. And that's my closing statement. So, Michael, I love you to bits for saying that. How can we lead someone down a path we haven't trodden ourselves? Exactly. And I don't think every therapist has to be an addict, but they have to do their own work. They have to want to do their own work. So bless you for saying that. I think it's one of the most important things. Great. Thanks, Mark. Michael, listen, take great care. I'm sorry I won't be able to give you a big hug. Virtual hug. Huge virtual hug, a cyber hug, whizzing its way from just southwest of London to you over in New York. Great. Thank you so much. Take great care, Michael. We'll speak again soon. Okay, bye-bye. See you soon.